the $200,000 that the health region provided is a mere pittance to their overall budget, but it was huge, huge to the community organizations that draw from it.
My name is Barb McPherson. I'm the executive director at the YWCA. I sat on the community, as a community partner on the review committee for the Saskatoon Health Region community grants from the last 6 years and up until now. And the YWCA has also benefited from the grants numerous times over the last many years. Before we start, first of all, I just want to acknowledge that we are on Treaty 6 territory, and that's very important that we remember that. Also, there is a letter we're sending to the powers that be on the table over here, if you want to read it and sign it before you leave today. Again, expressing concern about the actions that have happened in the last few weeks. So just to recap, on November 17th, news that the health region had pulled funding for the community grants began to spread through the communities that have greatly benefited from these grants over the years. Official notification came down on November 25th, I believe it was, although the grants were pulled from their website very quietly on the 17th with a little apology, and that's all that was there. Last Friday, a grassroots ad hoc meeting was called. I think it was Hillary from Upstream who sent out the email. And anyone who wanted to attend was welcome, and many organizations and individuals did come to that meeting. This is the first action as a result of that meeting. First thing I want to comment on is the method in which the funds were pulled. And speaking on behalf of my community partners and colleagues, we felt disrespected and negated by the suddenness of this action that happened without warning just days before the application deadline. Many organizations had spent significant time on applications only to receive formal notification 2 days prior to what was to be the application deadline. Our aim today is to express our concern over the actions that have taken place and to bring everyone's attention to the significant positive impact these grants have had in Saskatoon and surrounding rural communities, and to gain community support in advocating for the reinstatement of the community grants by the health region. We know the health region is in a tenuous position and is having to make some very difficult decisions to mitigate a significant deficit. Cutting the community grants program should not be part of this solution. It will save a paltry $200,000 out of, I believe it's a $43 million deficit they're looking at. And if the cut is permanent, it will result in increased emergent and acute care costs in the future. The programs that these grants support are preventative. They work upstream for many of the problems that our health region is facing. Our message is not only to the health region, but also to the Ministry of Health through the government, because they bear the ultimate responsibility for the funding. In relative terms, the $25,000 individual grants awarded through the Community Grants Program are insignificant within the context of the health region budget. But these funds in the hand of community-based organizations often leverage additional funding from other sources and result in significant programs that have supported marginalized people throughout the area served by the health region. With these funds, organizations have collaborated to build strong networks that contribute to the social fabric of our community that we are so proud of. At this point in time, we want to share a couple of stories and situations and perspectives from people who have benefited from the grants. First of all, I'm going to call on Bevan Bradley from the Saskatoon Community Youth Arts Program, commonly called SkyApp, to share about a program they offer that was funded through the health region. SkyApp was established in 2001 in order to address the social, economic, and educational needs of at-risk youth. SkyApp uses art and culture as the tool for personal development, empowerment, and redirection to healthy, happy, and productive lives. They have a multitude of programs that engage all ages throughout Saskatchewan. Bevan is a manager at SkyApp who has worked in all capacities of the organization, from program coordinator to personal development coach to grants writer, to a board member, and I understand she's just recently returned. She started at SkyUp when it was initiated in 2001 and has been involved through that time.
We at SkyUp were disappointed to hear of the recent cuts to the Health Region grants. The Health Region grants have assisted SkyUp with some recent programming, the Cultural Connections program, and our graphic novel and digital stories project. We had planned to apply for funding this year for our community drop-in program, a free drop-in program that uses art as a community engagement tool. The graphic novel and digital stories project provided at-risk youth, and the majority being Indigenous, the opportunity to record stories of other at-risk youth stories of resiliency. These stories were then translated visually through drawings and compiled into a published book. This project gave youth at risk an opportunity to engage thousands of youth throughout Saskatoon in workshops promoting healthy living. SkyUp's programs funded through the Health Region gave at-risk youth, the majority of youth being Indigenous, the opportunity that they would otherwise not have. The opportunity for skill development, engagement, to instill a sense of belonging, social and personal and life skill development. By evening the playing field for marginalized young people, we are offering an increased chance for better outcomes. This translates into improved health. In Saskatoon, we are seeing a larger and larger gap between the healthy and the wealthy and the impoverished. If you don't believe this, I implore you to take a drive through Saskatoon at night. Our downtown has changed drastically in the last 7 years. In a time when we see increased need for programming, we also see a decrease in funding opportunities. Preventative health care costs less. Our program at SkyUp and the programming of other organizations here today offer long-term solutions to health management. These programs should not be considered extras, add-ons, surplus, but rather essential services that contribute to a healthy community.
Our next speaker is Carrie Pratt, a young nursing student from Birch Hills. In the summer of 2015, Carrie graduated from Next Up, First Nation and Métis Youth in Action, a 5-day leadership training program for young Indigenous, social and environmental justice leaders. The Next Up First Nations and Métis Summer Training Program began as an important addition to Next Up's leadership programs because of the support from the Saskatoon Health Region Community Grant. Carrie has been a volunteer at Switch and has been actively involved in university and community health initiatives with a particular emphasis on northern, remote, and Aboriginal health.
Okay, well, hello everybody, first of all. Thank you for coming out today to share this dialogue with one another. So my name is Carrie. Like she said, I'm a student at the University of Saskatchewan. I'm finishing my 4th and final year in the Bachelor of Science Registered Nursing program. So I'm here today to speak about why I feel Saskatoon Health Region funding for the Next Up program has helped me personally, and why I feel it's important for health development in our communities. So I was involved in the 5-day intensive program, and I was really grateful for this option of the intensive program. Otherwise, I wouldn't have been able to accommodate the full 7th-month program in my already really busy schedule, and I know it's a challenge for a lot of other participants as well. So Next Up was really valuable to me as a student, and it will benefit my practice as a registered nurse. Next Up improved my critical thinking and taught me to consider the issues I'm interested in from a broader understanding. It helped me to develop the skills that I need to turn my passion and visions into realizable goals with steps and action plans. Just this recent semester, my professors and instructors have commended me for my ability to view nursing and societal issues from a systems perspective, and they have faith in my abilities to be a leader in nursing and healthcare. And I owe this entirely to my training in Next Up. Next Up is an important program for Saskatoon because it waters and grows the seeds that are the youth in this community. Youth that are passionate and willing to create healthy changes, but we need direction and we need support. Saskatoon Health Region has been a strong supporter of public health and community-based programs. Next Up is a community-based program that gives young leaders the skills and support to make their visions real. In my group, our visions included things like eradicating poverty and homelessness, working with Indigenous males and mental health, and addressing decolonization, just to name a few. And these are all topics that are essential to health promotion and development in our city. Saskatoon Health Region can show its dedication to health promotion in our communities by continuing to foster and support the individuals who are willing to inspire and lead their peers. Participants may not necessarily work in healthcare, but Saskatoon Health Region creates relationships and allies outside of healthcare professions in supporting Next Step. And these connections are necessary to create a coalition to work towards innovation and real change. So it's my hope that Saskatoon Health Region funding for this program will continue so that others can experience the excellent training that I did. In my opinion, capable youth leaders are essential to carry our province forward into a successful, sustainable province with healthy communities and healthy people.
People living in poverty for as long as I've been involved in this work in Saskatoon. As a past first voice co-chair of the Saskatoon Anti-Poverty Coalition, Vanessa knows what it's like to live on the margins, and she uses her experiences and her voice to advocate for a better community for everyone.
Thank you, Barb. My pleasure to speak to you today as the representative of the Saskatoon Anti-Poverty Coalition and Passion for Action Against Homelessness. It is intentional that this event is occurring on the International Day for Human Rights, and I feel honored to speak on behalf of individuals who live in poverty, who often feel that they have no rights, that their voice is not heard, and that they are invisible and silent. The issue before us is the last-minute and unexpected cancellation of the Saskatoon Health Region community grants. Very last minute, in fact, as several agencies had already completed their application for grant money after many hours of preparation, time that could have been put to good use in a day that for many service providers is already too short. Once again, people who suffer the most in our society are the ones who get left behind, out of the loop. Do the people who make the decision to cut such a vital service to community have any understanding of the social determinants of health? Are they aware of the backlash that occurs when services are withdrawn or simply not provided due to lack of funds? And we're talking about $200,000. An awful lot of money to a person like me, but pocket change when looking at the big picture. Over the years, projects funded by the grants have, for the most part, provided much needed service to those of our brothers and sisters who are most vulnerable. Programming that offers support either one-on-one or in a group setting with childcare, transportation, and healthy snacks provided. Projects that assist in building self-esteem and empowering individuals so that they feel they have a place in society. Providing individuals with an opportunity to meet others who may be facing the same barriers in life. Society says, get off the couch and get a job. Without the services that have been provided through the Community Grants Program, many individuals are not ready to apply for work because they need to start feeling good about themselves, or they feel that they don't fit or belong. There are many individuals who isolate themselves while they fight feelings of depression. Excuse me. What this really boils down to is prevention. That stream of healthcare going beyond what is offered by medical professionals. The social side of healthcare provides a needed course of prevention. Of course, there are additional services that in the past have been funded by community grants. So that brings us back to the backlash that I referred to earlier. Gaps in service, plus poor nutrition and inadequate housing frequently lead to poor health and eventual hospital stays. At what cost? What goes around comes around. Could this have been prevented by providing a grant for a small group of people to come together for mutual support, with childcare and transportation included? In closing, I'd like to quote Marcel Petit, a local artist and activist. He was the honorary chairperson of the 2014 Poverty Awareness Week, and he said, "We just have to start caring about each other more." Thank you.
Can I have your name?
I'm Kyla George.
What's the impact of the cuts from the health region on your work?
Well, I'm from the Mother Center, and we are one of the programs that are losing funding through the grant. And we're a drop-in center for mothers where there's a safe place to bring your kids, and we offer free coffee and snacks, and you can drop in and use the phone, the internet, and it's basically just like a safe place for mothers to meet other mothers and gain more information on how to be a better parent. It also is a really great community. To me, it means that I don't have a place to bring my son in the summer when it's really hot, because there's an air-conditioned building here, and it gives me a good chance to get out of the house when I'm stuck inside with my toddler, and to meet other mothers, and for my son to meet other children. It's a really nice community of mothers that have gotten together at the Mother Center, and it's a real encouragement for people to care about mothers like us, the inner city. And yeah, it's really disappointing that the money got cut. I hope that they make a different decision.
So what's the effect of the cut? What will be lost at the Mother Center with the money?
The whole program won't be able to, because we won't have a space. The funding would mean that we won't be able to pay next year's rent, so that means the program would be discontinued.
What can people do to try and get that funding reinstated?
I'm pretty sure talk to their local MLA. I'm not really sure what they can do, but contact the Anti-Poverty Coalition and the Coalition Against Homelessness. Is that what it is? Yeah. I guess that's why we're here today, is to try and tell whoever made this decision that this is really important to us and our community, and we don't want it to go away. It would be really not a very good thing.
Can I have your name?
I'm Carrie Prats.
Carrie, how important is it to stop these cuts that are happening to community groups?
To me, it's essential that we have this funding to develop our community and to work with people who need these programs the most. For me, health begins, it's way before you come to the hospital. It's about your job, it's about your home, your family life, it's about the support you have and all those good kinds of things, the social determinants of health, right? So I feel that the funding from ACHR, the $200,000 has really, really contributed to these programs, and I feel that the long-term impacts of removing these funds is going to have detrimental effects, and we're going to see the impact.
And with the organization you work with, what are the kind of impacts that are going to happen?
With the cutting of the funding. So when there's no next step, especially this intensive leadership program, what we're doing is we're losing opportunities. There's these youth in the community, in Saskatoon and the rural communities around, who see a great need for innovation and change and are willing to do that. But without support, they're never going to be able to. They can't be true activists without some encouragement and some guidance. So removing this program, we're losing those leaders, and I think we're going to lose a lot in our communities.
Now you're a nursing graduate,
yes.
Right?
I'm in my 4th year, so I have 3 months left, and then I'll be a nurse.
So what does it mean to you as somebody who's graduating in nursing, to see these kind of cuts and what that means to good health for people?
It's incredibly frustrating for me to see, especially because the program that I'm in now, we have a big emphasis on health promotion and upstream thinking. So to see the health region remove this funding is kind of backwards to what I've been learning. And I would like to ask them what their rationale is for it. I think the rationale is that they're seeing other problems such as aging in the healthcare system and other issues that seem more acute and probably more worthy of their money. I think what they're failing to see is that this small investment will have a really long-term investment for them. So,
Yvonne, how critical are these cuts? What do they mean to the community?
I think these cuts were really significant to the community. We also use these funds as leverage to access additional funds, to beef up programs, to beef up the funding base for some of the initiatives that we wanted to try and do. CHEP itself had a number of grants over the years that include things like a leadership manual for collective kitchen facilitators, so that we ensured that community folks that wanted to take the leadership training were their needs were addressed, and that we were really making it relevant to community members who wanted to take leadership training. These people were not always comfortable with some of the leadership training information that was existing in the manual, so we wanted to make it relevant. So that's the kind of monies that were plugged into these programs, is that we're making it so that we are very grassroots, we're very community based, we're addressing the needs of community members on the ground and trying to make sure that they are important players in this larger society that we have.
What can citizens do to help support keeping the funds?
Well, I would ask your, citizens can do anything like write letters. There's a letter that's being circulated right now, so sign on to the letter petition. We would ask for people to also take initiatives to, talk to other neighbors around them, so that others are informed of what these cuts mean to the community organizations. The community-based organization sector, or voluntary sector, is a really important one, because we operate and can stretch dollars like nobody's business. So it's important to understand the context of how we work and where we work and what we're trying to achieve.